Now, of course, I'm very interested in this definitely not group. I can't believe in South Africa we still have people who are saying, I'll definitely not get vaccinated. What reasons did they give during the survey?
Thank you, Maseko, and good evening, everyone. So just for brief context, so the COVID-19 vaccine survey collects information on factors influencing vaccine uptake, including vaccine hesitancy, but also access constraints among unvaccinated individuals. And as you just heard, we identified 4 distinct groups of individuals in our survey in terms of vaccine intentions and plans. There was the as soon as possible group, which was 1/3 of the sample. Then we had the wait and sees, which were about 1/5 of the sample. The only if required, around about 15%, and then the question rated here, the definitely nots were 25%. So we found with a definitely not group, these individuals don't believe the vaccine works. Only 10% of them indicated that they thought the vaccine would prevent them getting COVID. Only 10% thought the vaccine would prevent them getting really sick or dying. So the definitely nots don't believe the vaccine works, but also they have really deep-seated fears. A very large proportion of this group thinks that the vaccine will kill them. It was in excess of 70% reported this. So you have the group at the extreme who are very worried about safety, and they don't think it will work for them. So they don't see the need at all to be vaccinated.
Now, okay, so there's the only if required group. So these are obviously the group that is waiting to see if the mandatory vaccinations will be implemented. Did they not say why they just don't go now? I mean, they are clearly willing to do it.
So the only if required group follows a similar pattern to the wait and sees and the definitely don't knows, definitely nots, in terms of not really believing the vaccine works. So again, a very low percentage believes that the vaccine will be effective. And then they also are facing a number of different access constraints and access barriers and frictions which are preventing them from going. So they have all these frictions and these problems with access, but they just really don't see the value in going because they don't think it works. So that's sort of the only if required, and these individuals might be less likely to push back against any kind of requirements because they're not as worried about safety issues. They just don't think it works very well.
Now, tell us a bit more about the survey. You did speak to quite a number of people. Was it across all provinces in South Africa, and when was the survey conducted?
So we interviewed 3,500 individuals who were all unvaccinated across all provinces using brief telephone surveys. The surveys were conducted, almost all of the interviews were conducted after the announcement of Omicron. So the last week of November into the first 2 weeks of December.
Hopefully this survey, and I'm sure you're also hoping so, Doc, that after this survey, the people that you did speak to that are showing hesitancy probably by now have decided to go and actually get the jab.
Absolutely. And what's really encouraging was that there's 1/3 of individuals in the sample who were the as soon as possibles. These guys want to get vaccinated. They've got the intention, but there's just things standing in their way of doing so. So a lot of them report not having time. They don't know where to go. Many individuals still, about 25%, are still waiting to receive an SMS before going to the site. So they don't know you can go straight to the site. They don't know you can get vaccinated at some pharmacies. So there's some very sort of clear communication which could happen to help these individuals. And there's also sort of other structural and access barriers which could be overcome. So 70% in that group said if the vaccination would be brought to them at their home or work, they would get vaccinated next week. And 60% said, yes, if there's a 100 Rand voucher, they would also get vaccinated next week. So real signals that it's the frictions and the access barrier among this group which is important. And then the wait and see group, which is 20%, I think what's really encouraging is that more than 50% of the individuals were on the easier side to get vaccinated, to help convince, to help support. They were the soon as possibles and the wait and sees. Now, these guys, the wait and sees, they also have sort of low perceived efficacy. Only about 30% of them think the vaccine will work. What is really striking among this group is they have really large fears around safety. So when asked what the single biggest reason for not getting vaccinated, a large proportion said one of two things: either that they are currently sick or they have a chronic condition like diabetes, and they really don't think it's safe for them to get vaccinated with sort of a current illness or chronic condition. Then the second group really were worried about the severe adverse reactions or adverse events, such as death, blood clots, paralysis. So a lot of the old information around blood clots, etc., are still surfacing, but a large proportion are really worried about the vaccine killing them.
All right.
And I think the one really important point to make is that this is potentially largely about misunderstanding, not misinformation. With millions of people getting vaccinated, you are going to have circumstances where, by chance, someone gets vaccinated, and then for something completely unrelated to their vaccine, something happens to them. They get sick, they die. And a lot of people will put those two pieces of information together and make the association into causal. They'll think, there's a link here. The vaccine has hurt this person. So you're getting a lot of people reporting that they're not getting vaccinated because my father died when he got the vaccine. My daughter died. Many people really close to me. So it's not just rumors. It's much closer to home. People believe they are seeing first-hand experiences or potential negative effects. So there's a lot of work to provide safety assurances and assurances around efficacy as well.
All right, Doc. So I'm running out of time, but just quickly, the geographic, look at the survey that you conducted. Is it still the case that it's people in rural areas and far-flung areas who have more hesitancy than those who live in urban areas? We
haven't done the analysis at that level of detail yet. We recently got the data in, and we're being as responsive as possible to the needs of policymakers, but we haven't gone to that level yet.